Good evening, and welcome to the World Vision Auxiliary Session on Sustainable Community Systems Strengthening in Response to HIV Care and Support for Vulnerable Population. We're really happy to have you here, and we're glad to share experience with you. So on behalf of World Vision United States, World Vision International, Catholic Relief Service, and Save the Children, we are happy to welcome you. Thank you for making time to be here. It's been a long day, it's been a busy day, but we're glad because we've brought experts from the field, nationally and internationally, to share best practices, how we've scaled up community health development, building on strategic models and programs that are both owned at the community level and managed by them. Programs that are successful and sustainable are actually those that support community-identified health priorities that are owned and implemented by the communities. They are those that address basic primary health care, that bring healthcare services closer to the people who need it most, and mainly those in the community. They are those that are family-friendly, that will not require the mother to visit the health facility 3 or 4 times because of the various ailments she has for herself and the baby. And there are those that are built on existing best-known, proven best practices, building immunization on adding on to immunization, vitamin A supplementation, safe motherhood initiatives, and other known best practices, and not just running up with the new initiatives. And last of all, among others, is long-term funding commitment. And I'll just share 1 or 2 examples of such long-term commitments. I visited a program in one of the African countries where World Vision is working, and the Area Development Program in World Vision commits about 10 to 15 years to help communities develop. And in one of those communities where we have weaned off our support, I visited this program where there is home-based care and orphan care. And in this little square room that can accommodate about 30 people, I saw on the wall organizational charts, the members of the board, their work plan, their various activities. I was really impressed. And what really thrilled me more was last December, though they were not receiving any funding support, these women were able to write a proposal to the community organizations and bank in the community to raise funds to have a Christmas party for their clients. So I believe that was real sustainable initiative. And I visited another program where 30 caregivers were having their monthly meeting under a tree. And I said, aren't you shy coming to this meeting? Issues of stigma and discrimination. One of the leaders said, no, we are not shy. 2 years back, we were dying like chickens every other day. But here we are, strong, and we have a support group generating funds to meet the needs of orphans and vulnerable children. And above all, even those who are HIV negative want to be part of our community. So I think that is sustainable. And I'll allow the rest of the members of the team from the field to just show you how they've been able to accomplish this at the community level. And before I leave, I just want to introduce our honorable moderator. I have the opportunity to both work with him and evaluate programs under the AIDS Relief. He is Dr. Carl Staker, with over 30 years of international experience, and 20 of those has been in international HIV work. He holds a bachelor's degree in nursing, a master's degree in public health, and a doctorate in non-formal adult education. Charles Taker has been with Catholic Relief Service since 2002 and is currently working in post-earthquake Haiti as a senior technical advisor for HIV and health since February. He advises on the medical and health content of projects surrounding the temporary relocation, reconstruction, and operations of L'Hôpital Saint-François de Sales in Port-au-Prince, and rehabilitation of post-earthquake traumatic fracture patients. STECA also continues to stay current on HIV issues and others to advise CRS on its 280-plus health HIV projects in 62 countries. And for a man with several years of experience summarized in just a paragraph, I think it says so much of what he does. So let's clap hand for Carl Stecker. Thank you. And now hand over the program to him.